I'm Frank O'Kelly. I'm a GP at Clare House Surgery in Tiverton. I'm also a GP for strategic development for NHS Devon. At the moment there are a number of different service providers in the hospital, and they are North Devon District Hospital, who are the main governance leads for the whole site, the Royal Devon Next Hospital, who provide maternity services and theatre services, Devon Partnership Trust, who provide the mental health services, GPs who provide the ward cover, the cover for the minor injury unit, and some general practice work. And Devon doctors work out of their site out of hours and at weekends. There is a need, although they work well together at the moment, there is a need and a wish to try and absolutely maximise that. So the system works as one, and the hospital is used as a hub for the local community, because it doesn't work in isolation either within Tiverton or within the bigger healthcare system. Tiverton as a community hospital is at the centre of our local population. Services have often been delivered in acute trusts a number of miles away. The population 3 or 4 years ago were asked what they would like for the future, and the feedback was that they very much wanted as many services as possible delivered as locally as possible. The hospital is an ideal place to start that delivery of services. It is obviously a hub where many different providers are co-located, but it's also part of a bigger system that reaches out into the community. In the future we're going to have more people looked after at home, and the nurses, community complex care teams and OTs and physios can work from this environment, reaching out to those people and keeping them in their home and their own beds. We would like to make some very big improvements in terms of service delivery in that time, but it's going to be a long-term process. The population of Tiverton is predicted to grow by 3,300 according to the Joint Strategic Needs Assessment over the next 15 years, and yet the population, that same population of over 65s is going to grow by 3,800. The services that we need for the future are different to the services we have had or have now, so it will be all part of an ongoing process.